way, especially with having had that interspinous ligament tightness. And then I would drop down the angle of the legs like that. Sometimes in someone with quite a severe and tense anterior movement, just doing this, then you're going to have to put one leg down at a time so that they don't get any hyperextension into the facets. And then one leg up, two legs up, and you push down like that. Or you do that. It's quite nice. You do have to be careful if someone's hip joints are really stiff or restricted or osteoarthritic, because that can jam them. But generally, pushing down like that will always give them relief. And then one leg down at a time, lift this out, relax that down. So that's the